Radiotherapy treatment prescription. Radiotherapy treatment prescription involves specifying the parameters for delivering radiation therapy to a patient. In the case of 4 megavolt X-rays, it refers to the use of a linear accelerator that generates X-rays with an energy of 4 million electron volts. Given dose indicates the prescribed radiation dose to be delivered to the target area or tumor. Percentage depth of dose at the center refers to the percentage dose delivered at the midpoint of the radiation beam. Volume irradiated refers to the region of the patient's body exposed to radiation during treatment. The specific volume irradiated would depend on the treatment technique, beam arrangement, and the size and shape of the radiation fields used. Multiple beam directed technique involves using multiple radiation beams to deliver treatment from different angles. This technique allows for better targeting of tumor while minimizing radiation exposure to the healthy tissues. The dimensions of the radiation fields are beam width, beam length, number of beams. Proper beam shaping is important to ensure accurate and precise delivery of radiation to the target area while sparing surrounding healthy tissues. Symmetrical and non-symmetrical arrangement. Symmetrical arrangement involves positioning radiation beams symmetrically around the patient, providing balanced exposure. Non-symmetrical arrangement refers to the use of beams from different angles which may be necessary to target complex tumor shapes or spare critical structures. Parallel opposed beams. Parallel opposed beams involves delivering radiation from two opposite directions converging on the target area. This technique helps to minimize radiation exposure to healthy tissue located between the beams. Wedge parallel opposed to pair plus plane beam and inclined wedge pair plus plane beam. These techniques involves using wedges to modify the radiation beam's intensity across the treatment field. The use of wedges can help achieve more uniform dose distribution across irregularly shaped target areas. Double wedge pair technique utilizes two wedges, often with opposing angles, to further refine the dose distribution within the treatment field. This technique allows for greater flexibility in dose modulation and conformity to the tumor shape. Superficial lesions refers to the tumors or abnormal tissues located close to the skin surface. Specialized treatment techniques such as electron beams or superficial X-rays may be used to target these lesions while minimizing dose to deeper tissues. Palliative treatment aims to alleviate symptoms and improve the quality of life of patient with advanced or incurable diseases. Radiation therapy can be used to palliative settings to provide pain relief, tumor shrinkage, or control bleeding. The tissue-air ratio is a correction factor used in radiation dose calculations to account for the variation in dose position within the patient's body compared to the dose measured in the free air. Rotation therapy versus fixed field therapy involves rotating the radiation source or patient during treatment. This technique allows for more uniform dose delivery and better sparing of healthy tissues. Dose at the center of rotation refers to the radiation dose delivered to the target area or tumor located precisely at the central axis of the rotation. Fixed field therapy, on the other hand, involves delivering radiation from static beams without rotation. The choice between these two techniques depends on the specific clinical scenario, target shape, and dose requirements. Thank you for watching.